There is a trend across Michigan concerning those in healthcare. Cases of pertussis, or whooping cough, are 2.5 times higher than average this year. For the past few years, Michigan averages about 590 cases a year. As of December 8th, there have been more than 1,500 in 2024. Pertussis is a highly contagious respiratory infection known for severe hacking cough, followed by that high-pitched breath that sounds like a whoop. It can even cause death for some infants. There is good news. There's a vaccine to prevent it.
Over half of our cases are in school-aged kids. So those are kids that are between 5 and 17 years old. And 66% of our cases, two-thirds of those cases, either don't have any evidence of a vaccination, or their most recent vaccine was from more than 5 years ago. And that's important because we know that the effectiveness of pertussis vaccines can wane over time.
That's the director of immunizations for the state. He says even though the vaccine has been around for many years, fewer people are getting them for their children. School waivers have increased. Twice as many parents opted out of vaccines for their children this year than in 2020. Healthcare providers call this a concerning trend.